was 20 U.S. senators that came together, Republicans and Democrats, to say we need to deal with the energy situation. We need to work together. We need to stop this partisan bickering and everybody positioning for their candidate for president, and we need to deal with the situation. It's naive to say, oh, let's just let the ban expire and then it'll all be fine. That's not going to happen. There had to be put in place a plan that would incent the states to actually develop their own resources. That's what was a significant portion of that agreement. Again, 20 senators, 10 Republicans, 10 Democrats that came together to work on it in a constructive manner. So just letting the ban expire did nothing. The ban has expired, and if that legislation is enacted, we will have in place a plan to develop our own resources.
Okay. Let's move on to the health care issue. We have a meeting ban to prepare for the health care issue.
Good evening, gentlemen. This is a two-part question. The first is, many Americans welcome the idea of having affordable health insurance. How will you assist them in helping provide health insurance?
Okay. Mr. Thomas, please.
Another critical issue. Health insurance obviously affects all of us, and really it is complicated, but the prices continue to rise and it is hurting people. We do need to look at ways that, and we've seen great progress made in this with the health savings accounts, where it enables people to set aside their own money, tax-free, to then pay for their own health costs. Ideas like that, free market ideas, need to continue to be explored so that we're not suffering from overly high health care, but at the same time, the government cannot go out and promise everybody, oh, we'll just give everybody health care. That's impossible. We talk about the deficit. You want to see the deficit go through the roof if the government tried to say, oh, we'll provide health care for everybody. So we need to look at ways that are market friendly and that do that. Saxby took a lot of criticism for his vote against the expansion of SCHIP, which is this children's health insurance program, which was enacted to help children receive health coverage for needy families. It was a great program. The Democrats in control tried to come in and expand it to cover adults and folks who were not just low income, but folks earning as high as $80,000 in some states. That is not the goal of a children's health insurance program, and Saxby voted against that. Mr. Buckley likes to talk about all the spending. Saxby took a stand on spending on that issue. He took a lot of criticism for it, but he did the right thing. Children's health insurance needs to stay focused on children, but it's a very important issue, obviously.
This is up to
Saxby's record on spending is clear. I mentioned it. Record deficits, 1.5 trillion more debt when he was in the Senate between 2001 and 2006. Just so you know that an interest rate of 5% that costs you, the average family, $650 a year indefinitely. I do employee benefits for a living, and I've got, not to brag, but I think I've got some really good ideas for health care. I can't explain them all tonight, but I'll give you the general gist. When you go to a restaurant, let's say you go to McDonald's and you buy a burger and fries, you pay for it. You go to the appliance store and you buy a new TV, you pay for it. You go to your doctor to get health care, somebody else pays for it. You pay a part of it. It depends on the circumstances. We've got a three-party system with health care. You got a provider, a consumer, and a third party. And that third party is either an employer or an insurer or the government. And whenever someone is paying a significant piece of the price, there's not enough incentive on the part of the consumer to control costs. So what I advocate is we really push high deductible health plans that work in conjunction with health savings accounts, HSAs, that Mr. Tomczak mentioned. And we offer an income tax deduction for high deductible health plan insurance coverage. Or at the choice of the individual, a 28% refundable credit. So lower income people would have 28% of their health care paid for by the government, or middle income people, and then higher income people can take a deduction. So there's an incentive to get that coverage, and you limit employers' deductions to the high deductible health plan premium amount. And high deductible health plan coverage basically is what it sounds like. It's got a high deductible, so there's an incentive to control costs right off the bat. On the provider side, we need more competition. Georgia has certificate of need laws, which say if you have a hospital in a particular area, no one can put a hospital anywhere around you unless they get a permit from the state. So anyone who's got that hospital fights as hard as they can to prevent any competition. We say to the states, you want the Medicaid money, eliminate your CON laws. We also say, if you want Medicare and Medicaid money providers, you have to pursue everyone who receives health care for payments. Everyone. Otherwise, you're not going to get that money. We put an electronic similar to the IRS method, which if you're familiar with it, it's very easy for the IRS to collect on its debts. Because if you participate in an electronic healthcare database, you can use this very simple method to collect on the debts. And all of a sudden, a lot of people are, now you got people out going out getting healthcare coverage. Because most people who don't have coverage have made a decision not to get coverage and they can afford it.
Okay, thank you. We have another health issue prepared by Marianne Chung, who has a question about the health disparity.
Good evening. What would you do to bridge the gap of health disparities that exist in minority communities? For example, in the Asian American community, cancer is the leading cause of death, where heart disease is the leading cause of death for all other groups. Also, too many times, data does not even report Asian American.
Is it comment, please?
It's a good question, thank you. I personally do not know how to solve that issue, and I wish that I did. Again, we do need to look out for the folks that are truly needy and make sure that insurance programs and any government spending are targeted to those, just like that SCHIP program was for children. It needs to stay that way. But it is a legitimate role of government to look out for the needs of communities that need to be taken care of, especially when it comes to the healthcare issues. But I'm sure Mr. Buckley can speak to that much more effectively because he's an expert. So I'll turn it over to him.
I wouldn't say an expert, but I do think we have the greatest university systems in the world in this country. That's one of our really great assets. I think another one of our great assets is we don't have a caste system. A lot of countries, you grow up in a certain family, you're stuck there forever. And one of the great things about the United States is anybody can make it. Look at Britney Spears. You know, she came out of nowhere and the super. But I think that there's so many good causes. And you see Jim Martin's website, he wants to take care of Alzheimer's and fund this and that. But there's so many medical problems. How do you decide which ones should get the government's help? I mean, there's all different kinds of illnesses and mental illness problems. You know, who's to decide that this is what we're going to fund? And if you fund them all, you talk about financial problems now, the government will be completely broke. What I suggest is we simplify the tax system the way I described, and we continue to allow an income tax deduction for contributions to charities, universities. And so, as of now, I don't know what you all are like, but I constantly probably get 3 or 4 letters in the mail every day from different charities saying, send us money. And I decide the ones that I think are good charities. And I think that's the best way of handling these problems. Some people might think, Alzheimer's is a great thing to fund. So you send your check and you get a tax deduction. If the tax rate is 33%, the government pays a third of it, you pay 2/3. And just remember, whenever the government pays for something, that means everybody pays for it. It is the reality. And let's offer rewards in these areas. Let's say, hey, if you find a cure for cancer, you'll get a $10 billion reward, like the Nobel Peace Prize. And, if you win the prize, you get a cash reward. Let's offer rewards for breakthroughs that are healthcare breakthroughs that help everybody, because that would help reduce the cost of Medicare and Medicaid, and that would help all of us indirectly.
Thank you. Tonight's audience is representing many different kind of communities. A lot of them are immigration communities, so they are very concerned about the immigration policies. We have 2 immigration questions. That is the last 2 questions before closing. So we have John Park, who has a question about immigration policy.
Good evening. The need for immigration reform is a key issue for many members of the minority community. If elected, what types of changes do you propose to reform our current immigration system?
Is it comment?
We do need to reform it, and that is why Saxby got involved in the immigration debate last year. He recognized there's a problem, and it needed to be solved, and the federal government needed to take action. They ignored the problem for 20 years, going back to the '86 amnesty bill, which just let folks who are in the country illegally stay here and have, be on a pathway to citizenship. Saxby said we need to address this problem. We need to secure our borders first and foremost, so that we know who is coming into the country. Then second of all,